Dr.PB Jaya Gopal, sir. Sir is a senior interventional cardiologist practicing in Palakkad. So tomorrow you will be presenting your work on intracoronary usage of thrombolytic therapy like Tenecteplase. So we'd like to know how had been your experience with this kind of a usage of Tenecteplase in your patients, sir?
Well, I think we have quite a vast experience with Tenecteplase. If I remember correctly, I think we were one of the participating centers when this got introduced in India. And then we had initially it's about 100 patients on Tenecteplase with a near 100% follow-up, angiographic follow-up. And we found this to be an extremely useful molecule. And from there, we have taken it ahead. We have actually had a very large group of patients where this has been tried locally, also intracoronary as well. And this has been found to be very useful. And in fact, we are presenting our data here tomorrow on the abstract session. And you'll see the results tomorrow. But
yes.
I would like to say that this has been found to be in something which really people have not noticed. So this is something which I think will be of really use for the interventional cardiologists.
So is it a routine practice for you to use intracoronary Tenecteplase, or it's in a specific subset of patients you try this route?
Yeah. No, it's not a routine practice. See, in fact, we are mostly an interventional center where our primary angioplasty works 24/7. And then most of the patients are taken up for primary angioplasty. In fact, the kind of patients that we studied, all of them actually were scheduled for a primary angioplasty, and we found extensive thrombus in these patients.
Okay.
And this subset actually were the group who had an intracoronary and a follow-up with a heparin and all that. So, and we've actually had a follow-up study, and the results it'll speak for itself.
And what is the dosage you use for intracoronary usage?
Well, this is actually, we based our study based on the use of intracoronary streptokinase, where it was actually 1/5 to 1/6. We have used 1/5 of the recommended IV dose.
Okay.
But then we followed up all these patients with the remaining 4/5 intravenously as well.
Okay.
But the beauty of it is that after giving this intracoronary through a guide catheter, we have had a study about 5 minutes later, a check shot, which showed that this was really working.
Okay.
And so all of these patients had a restudy at the end of 4 hours, and it's been a really rewarding experience in terms of usage in patients with huge thrombi.
Okay.
Particularly young patients, a lot of patients with ectatic coronaries where you really can't place a stent. The vessel is too big to hold a stent. And so this subset, it works wonderfully well.
So in group of patients with a thrombus load is very high.
Very huge thrombus burden, yes,
huge.
right.
And stenting may be difficult in these patients.
And I would put it this way, it obviates the need for stenting.
Okay.
Because in a young patient, you find that the vessel is absolutely clean in some patients.
Any message you would like to give other colleagues regarding usage in intracoronary?
Well, I think most of the people, it's sort of an impulsive reaction. When you take up a patient for an angioplasty, people want to put in a wire across, balloon it, and then put in a stent. I think when you find a large thrombi, I think sometimes it has a disastrous consequence when you try to do an intervention, slow flow and things like that. Today we know that none of the aspiration catheters work. So in this subset, many people are scared. They are really not aware of the data. In fact, I can tell you that if you even look into the literature, there's just some anecdotal reports, and maybe the largest number of patients, about 25 plus. So I think this is something which could probably be used in a larger group of patients, and then I'm sure it will be effective.
Thank you, sir. Thanks for sharing your views, and look forward to see your results tomorrow, and probably this will help larger group of physicians to see these patients and give them the maximum benefit of intracoronary use of Tenecteplase.
Yeah, you're welcome. It's my pleasure to be part of this program, and then I think I think this message will be carried forward.
Surely. Thank you. Thanks a lot, sir.
Welcome.
So we'd like to know how had been your experience with this kind of a usage of Tenecteplase in your patients, sir?
Well, I think we have quite a vast experience with Tenecteplase.